Did Medicare inform you very well that it was coming your way and these are the people that would be able to help you?
Oh, no. But we never received a list of providers for competitive bidding, and that has been a process also. Like there's one provider in this area that's been very good about helping us before competitive bidding, and if I even get in a jam right now, I'll call them like, just please help me, and they'll say, okay, we know somebody we think who in this area can do it. Oh, that happened on a Friday. So I called that person and said, I need a hospital bed, and they said, well, we can deliver it on Saturday. So I went out Saturday to check on the patient, the bed wasn't there. I went out Monday, the bed wasn't there. So I called the person that I had been referred to, and they said, oh, we don't do the bed, so we sent it to this company. So I called that company on Monday, and they said, we never received any information on this patient. So now I had to start all the way back over. So when this came down, now I'm assistant director of nurses in this home health. I do the admits. A lot of times I'll go out when the other nurses are busy. So I deal with it in the office from get the order to get the equipment, and I deal with it in the field I'm in the field and I need this equipment. Medicare kind of pushed out a whole lot of new rules as of the first of the year. We had to do face-to-face encounters with doctors. We had to do the therapy visits, now have to have a re-eval on the 13th and 19th visit. So there was a lot of changes that came out, and there was so much that came out that may have came out, but we were so overwhelmed with, you have to have the face-to-face encounters, you have to discharge, or you have to have the 13th, 19th therapy re-eval, or you're going to have to discharge. But that may have been a small blip on the radar, but we really didn't pay that much attention to it until I called our medical equipment provider, who's been very diligent in getting equipment, and they just said one day, we can't do it. We had no list of who was coming, who to use, so it's been a very aggravating, kind of a scary procedure or protocol since this has happened, because I don't even know who to call for oxygen now. I just have to call and call. I just have to pull up Google a list of DME companies and call. Are you a provider for oxygen? Are you a provider for a low bed? So that's very time consuming. And it delays care.
Mm-hmm. Before competitive bidding, how many providers did you work with versus how many providers that they're available now? Do you know what that number is?
I know before in this area we had a list of available providers that we could go to for any equipment, and that was probably 10 to 15. In say a 25-mile radius. Now that's who we used. Mm-hmm. I'm sure there's closer to 30 or 40, but we used 10 to 15. Now I can only find one provider for like the low bed, the air mattresses, the hospital bed, and that's the provider in Garland that's 30 miles away, basically, and that provides for the whole area, and who only delivers to this area one day a week. So say they're going to only deliver on Tuesday, I get the order on Wednesday. Well, that person will go without a hospital bed, or without an air mattress, or without, I don't even know if they provide oxygen. I haven't even asked them that, but if it was oxygen, it would be that long. And they don't deliver on the weekend, so if you have somebody who comes out of a hospital on a Friday, they're going to go the weekend without a wheelchair, or without a hospital bed, or without an air mattress.
And if they're on oxygen, obviously they're going to have to stay in the hospital.
We won't accept them.
Sure.
The hospital can't, and I've had to do that in one case. The hospital cannot discharge until we agree to accept responsibility. And there was one piece of equipment that we could not get, and I was not comfortable having that patient discharged home without that equipment, so they had to stay until we could get that equipment set up in the home. And it was 3 to 4 days. So that's a bad. Mm-hmm. I mean, the hospital's a great place to get better, but it's not a great place to get well to me. The longer you stay in, the more you're at a risk for an infection or contact with somebody else who's sick. So home is the best place to get well.
You have the ability right now to say anything to your congressmen and your representatives in the state of Texas about competitive bidding. Now's your time to go ahead and say something.
I understand the philosophy behind competitive bidding, and I understand why you're doing it, but I think that it's not helping. It's hurting. It's costing more money because people are having to stay in hospitals longer. It's costing more money because people aren't getting the equipment that they need, so they're falling, requiring more care. I think that there has to be oversight as far as durable medical equipment goes, but I don't think that it's fair to punish everyone and make our job harder, make people's lives unsafer due to competitive bidding. I believe there's a better process for this, and that you really should look at how it affects patient and patient care.
And can you give us your name and kind of your background, your personal professional background?
My name is Cathy McMullen. I'm a registered nurse. I went to school at Texas Women's University here in Denton. Worked in the hospitals and ICU for a while. Did some hospice care and have been in home health now about 5 years. Really love it a lot because you have people in their own homes and are able to see them get better and stay in their own homes, which is, I think, a goal of everyone I know, and I'm sure yourselves included, to have the best quality of life for as long as you can have that quality of life, where you prefer that quality of life to be. So I guess that's about it.